Good morning, everybody. Thank you for joining us for our press briefing with regard to the state's response to the pandemic. And again, as always, we want to remind people, please continue to use all the tools we've given you to slow the spread of the virus, making sure that you keep that 6 foot of distance between you and other people out in public. Wear a mask when you go to the store. Wash your hands often. If you've got that cough, fever, lost your sense of taste and smell, please stay home. Don't take the risk you're going to spread the virus to somebody else. Avoid the 3 C's if you can. All these things have helped us to get to the point where now we're down to about 150 people in the hospital with coronavirus. That's roughly a little bit less than 4% of our overall hospital capacity. And that's about where we were, the last time we were down that low was actually August 23rd of last year. So we're making great progress. We're rolling vaccines out. We're going to talk about that in just a second. But we want people to continue to practice all the good things we know will help slow down the spread of the virus. So please do that. Also, want to remind people that Test Nebraska is still out there and available for people. So you can go to testnebraska.com, sign up, schedule yourself. We've delivered 695,000 test results back, and we are generally turning those test results around in less than 24 hours. In fact, the last time I went, it was less than 8 hours to get my test result back. So that's coming along very, very well. And of course, all of this is around designed to keep our hospital capacity robust so we can provide that hospital bed, that ICU bed, or that ventilator to anybody who needs it when they need it. Right now, our hospital capacity is at 34% of our hospital beds are available, 34% of our ICU beds are available, and 78% of our ventilators are available. So we've got robust hospital capacity there. So again, please do that. And then also with regard to the vaccines, we've delivered over 447,000 vaccines as of today, and we have moved up, as I mentioned on Monday, that we've moved up from 45th to 30th, and that ranking has now moved up. With 80% of our vaccines used, we are at now number 18 on the New York Times ranking with regard to percent of vaccines being used. So obviously we want to see that number continue to go up. We're going to continue to focus on getting vaccines in arms and working with our local health directors to be able to get that out as quickly as possible. So we've got a couple things we're going to talk about today, but the first one we're going to talk about is vaccines. Oh, actually, before we get into that, though, I do want to remind people to sign up for the vaccines. You can go to vaccinate.ne.gov, so I want to get that out there right away. So please, as you're looking down the road, get signed up. That's how we'll contact you to get you scheduled to get that vaccine. So sign up at vaccinate.ne.gov to be able to do that. That's an important thing to be able to do, so please do that. And then if you don't have access to a computer and you don't have anybody who can help you with that from a computer standpoint, you can still dial in to 833-998-2275 and call and talk to somebody there. So again, 833-998-2275 to be able to talk to somebody and get registered as well. All right, so now we're going to go ahead and get into our vaccine discussion here today. So as we get vaccines in arms, we're looking down the road to see that we may be approaching getting into phase 1C and then phase 2A. And so one of the things that we're talking about when we get into phase 2A, we're going to continue to prioritize based upon risk. And that means as we get into phase 2, we're going to be looking at inoculating people who are 50 to 64. Now, similar to what we've done in phase 1B, where we've directed the health directors to focus 90% on the 65-year and older category, we've also given them the ability to use 10% to hit some of the folks we needed in public safety, the utilities workers, educators, and so forth as part of that. We're going to take a similar approach as we get into phase 2 with regard to underlying conditions. So again, age is the #1 contributor, the single biggest correlation to your risk at hospitalization and death, and so that's why we prioritize those folks who are 65 years and older. And again, as we get into phase 2, we're going to prioritize, again, people by age, that 50 to 64, because those people are the next highest category being at risk. But we are going to allow providers to be able to get folks who are going to be, who have underlying health conditions that may put them more at risk, to work with the local health directors to be able to get them vaccinated as well, even if they're below the age of 50. So to that category, that point, I'm going to have Angie Ling, who's our incident commander for the Department of Health and Human Services, and who is the person who's been really spearheading our pandemic response here with regard to specifically the vaccines, as well as the other aspects of it. But Angie, will you come up and talk a little bit how what phase 2 is going to look like and how we're going to incorporate in those comorbidities?
Good morning. Thank you, Governor. So just a quick recap on our vaccines. For this week, our allocations coming in will be primary doses, Pfizer, 23,400, and Moderna, 19,000 doses. And then Johnson & Johnson, we did get a one-time shipment of 15,500 doses, and that is a single shot, so one and done. And then we will have a gap in our Johnson & Johnson after this for a few weeks, and we'll get some more towards the end of March is what we're being told. After a delay in our distribution for the week of February 15th, we have received 3 weeks worth of doses in the last 10 days. And last week, we administered nearly 78,000 doses. As our prioritization has changed with an age-based focus, we are aware that medical conditions can still increase a patient's risk of poor outcome from COVID-19. When we move into phase 2A, which is very near, we will ensure up to 10% of the weekly allocation is allotted for high-risk medical conditions regardless of age. The decision of who will be vaccinated with those doses will be made by the medical community. The state will not be determining what medical conditions are included. The medical community will identify the appropriate patients and work with the health departments to get them scheduled. Depending on the location, those identified with high-risk medical conditions may be vaccinated in a special vaccination clinic specific for high-risk conditions. Other locations may opt to get those patients scheduled into already existing community clinics. The other 90% of those doses will go to the 50 to 64-year-old group, and therefore those in that age group will be able to be vaccinated based on age. If you're in this age group and the medical community has identified you as high risk, they will work with you to get you vaccinated as early as possible. It is important to note that not all medical conditions are the same. For example, a person with high blood pressure that is controlled on one low-dose medication is very different than a patient with high blood pressure maxed out on 4 medications and still has uncontrolled blood pressure. This is why it is important to allow the medical community to make these decisions so we can get the highest risk patients vaccinated as soon as possible. Nebraska continues to move through the 65 and older population and the identified critical infrastructure groups and look forward to expanding the age groups in the next few weeks. It is imperative for everyone who wants to be vaccinated to register with the state registration system at vaccinate.ne.gov so we can get you scheduled as soon as possible. Moving forward, the state system will be the sole source for signups. We did import all of the registrations from the local health departments, but if you are concerned that we did not get your registration, feel free to go ahead and register at vaccinate.ne.gov. You can also call the call center toll-free at 833-998-2275 for any assistance in registration or additional questions. I will continue to provide these operational updates as we have them. Thank you. Thank you, sir.
Thank you, Angie, though you just stole my sheet.
Oh, did I?
You totally did. You just stole my sheet. Thanks very much. All right. So again, for those who were asking questions last week with regard to the underlying health conditions, we said just be patient with us. We're going to have an announcement. That's the announcement that we will be getting to those conditions in phase 2 in the way that Angie just described, that we're going to be dedicating 90% to that category 50 to 64, and then allow local health directors to work with medical providers and healthcare professionals to determine for that 10% to prioritize folks with comorbidities that don't fit into that category of 50 to 64. But again, I want to emphasize what Angie said. It's imperative, regardless of where you think you're going to get your vaccination, to go register on the state's website. So we have that information to be able to process that vaccination. All right. So that is our announcement with regard to the vaccination. I also want to highlight that we have previously announced the Emergency Rental and Utility Assistance Fund. This is a federal program where the state is administering $158 million. The state of Nebraska is getting a total of $200 million. The state website is up for people to apply. We have people applying right now, and we expect that we'll be sending checks out to those folks. And this is the program where either the renter or the landlord can apply to be able to get assistance for rental or utilities, and it's based upon being impacted by the coronavirus. So we just want to remind people that if you go to coronavirus.nebraska.gov, again, that's coronavirus.nebraska.gov, or you can call 1-833-500, let's see, what's the last four numbers? 8810. So again, 833-500-8810, and you can call that number, but again, you can get registered for the rental assistance program. So please take advantage of that. That system is out there. Now, again, just to highlight, though, that Omaha, Lincoln, Douglas, and Lancaster counties will have their own programs, which I expect will be stood up here in the next couple of weeks for folks to be able to apply if you are in those locations. So if you're in Lancaster County, you'll apply to Lancaster County. If you're within the city of Lincoln, Lincoln will have its own setup. Same thing for Omaha and Douglas County. If you're in Douglas County broadly, Douglas County will have a program. Omaha will have its own program. But if you're not in one of those two counties, right, if you're in the rest of the state, you can apply for that rental assistance at coronavirus.nebraska.gov or at 833-500-8810. All right, so that, and then finally, one other announcement we want to get to is our Developing Youth Talent Initiative. This is a program that we launched back in 2015 to help make sure we got a talent pipeline here in the state. One of the biggest things employers talk to me about is that they cannot find enough trained, skilled people to be able to hire. And so what we want to do is create that talent pipeline, really starting in 7th and 8th grade, moving it all the way through the high school years, and then into post-secondary education so that we have the trained, skilled workforce that employers can hire and create great careers for our young people here in the state of Nebraska. So the Developing Youth Talent Initiative is a grant program where we issue grants to companies and school districts to work together to create these programs in 7th and 8th grade to expose our young people to careers in manufacturing and IT and healthcare so that they can see those types of careers and start pursuing them. And we really want to start early so that we give those young people an opportunity to really explore it fully. And the idea would be start in 7th and 8th grade, have a career academy in high school, maybe earn some post-secondary education credits, and then follow it up with either a 2-year or 4-year degree after you graduate high school. So every year we do a grant program for this, and we've had some wonderful successes. For example, one of our first grant award winners was FlowServe in Hastings. They introduced this to their 7th and 8th graders and found that they had a 15% increase in the number of 7th and 8th graders, well, 8th graders, as they move in 9th grade that took their skilled technical science course or their career academy equivalent there in the high school. In Hebron, MeadowQuest worked with the Sandy Creek and Lawrence Nelson schools to be able to, again, expose young people to careers in manufacturing. And in that case, what they found is before the class, 39% of the kids really had an interest in manufacturing. After the class, 75% of the kids did. So a great increase in the number of kids who are interested in that career field. Aulick Industries in Scottsbluff did something similar. They had a program around computers and IT, and they found that 39% of the young people felt like they had a good idea or knowledge of what those careers would look like before the class. 60% felt like they had a good idea of what those careers in IT would look like after the class. And then Orthman Manufacturing in Lexington created 3 mobile labs, kind of maker spaces if you want, with things like robotics and hands-on kind of activities that they then moved around to 11 different schools. So great opportunities there for young people to get that hands-on experience. And in fact, over the course of the last 6 years, we've been able to get to 59 school districts and 22,500 students have benefited from the Developing Youth Talent Initiative. So, why am I telling you all that? Well, it is time once again for people to apply for the Developing Youth Talent Initiative. And again, you have to have a company and school work together for this application. Applications will be due by May 16th, and you will apply at the Department of Economic Development, who administers that program. So again, we want to announce that the application period for the Developing Youth Talent Initiative is now open, and that those applications are going to be due by May 16th. So please, if you have an interest in this program, I know lots of schools have worked with these companies to, for example, buy equipment so they can have state-of-the-art equipment for the schools to be able to have the students work on. It's a great application of this, so please work together between your private sector, companies in your community and your local school districts. Make that application. We would love to have you on board. Last year, our grant award winners were Klaus Manufacturing in Omaha, Kawasaki here in Lincoln, and Nucor Steel in Norfolk. All right, so with that, we'll go ahead and open it up to questions and answers. And Taylor, I think we had a couple of questions that were sent in ahead of time.
Paul Hamill is asking, is there some accommodation being made now that there are two Catholic dioceses, St. Louis and New Orleans, that have advised folks to avoid the Johnson & Johnson vaccine?
So Paul Hamill of the Omaha World Herald is asking, is there some accommodation being made now that two Catholic dioceses, one in St. Louis and one in New Orleans, have said to avoid the Johnson & Johnson vaccine? So with regard to the ethical qualities of the vaccines, I think that's a very personal decision, and I would encourage people to work with their healthcare provider and their faith leaders to be able to make that decision. We at the state are, working to allow people to know what vaccine will be distributed, but I do want to highlight that all three of these vaccines are like 100% effective at keeping you out of the hospital, 100% effective in preventing death. So these are very important vaccines in protecting your health and safety. But again, with regard to the ethical matters, I encourage you to work with your healthcare provider and your faith leader.
John Chapman from WWT would like to get your opinion on LB 577, and if the bill gets to your desk, would you sign it?
John Chapman, WWT, wants to know about LB 577, which I believe is the bill making Election Day a holiday. Is that right, Taylor? And that is correct. And so again, typically I don't comment on bills until the legislature's had a chance to debate them, but in this case, we don't need another state holiday to be able to allow for elections. We've been doing those successfully for many, many years without it, so that is not a bill I would support.
Jose Zasiah from KTV has two questions. He says, with a third vaccine product in the toolkit, are there plans for large site or drive-through clinics on a state level, or will that continue to fall to local health districts to coordinate?
So Jose Zasiah is asking about, with Johnson & Johnson coming in, will we be setting up a large state-level vaccine clinic, or will we continue to work with local public health directors? As Angie Ling said, we're going to get a one-time dose of this Johnson & Johnson, and then we probably are not going to get any more until the end of the month. So we're going to continue to work with local public health directors. And again, you just look at the work here in Lincoln. Pat Lopez has done a great job at the Pinnacle Bank Arena. I toured that facility, or I toured that program when they had it here last week. Audie Poor with regard to the Creighton Clinic. Again, we had tons of staff and students volunteer to be able to help man that clinic. That all went very smoothly. So we're going to continue to work with our local public health departments in the near term with regard to these vaccines.
And then he also asks, would the state monitor if local pharmacies are keeping wait lists for people who want vaccine and are in the current phase tier? He says an example would be responders getting appointments in high-V locations, but not teachers yet.
So the question is, Jose Zazai is also asking if pharmacies are managing the wait lists with regard to groups. Right now, they're supposed to be prioritizing age 65 years and up. But Angie, I'm going to ask you to come up and talk a little bit more about the pharmacies and how that program's working.
So the pharmacies are required to work with the stipulations that we have set forth to the CDC. So right now, all the federal pharmacy programs have been opened up to 65 and older Phase 1A recipients and then Phase 1B, but they are to track along the same location or the same rhythm as the health department. So if they're in first responders, then the pharmacy will work with them to do first responders and keep moving through in that regard. Right now, there's a lot of information sharing between the pharmacies and the health departments to make sure that we have lists that can be prioritized and get those folks taken care of to make sure those doses are getting in arms. And then as we move forward, the federal pharmacy program, the pharmacies will be moving to the VRAS system as well, so we'll all be working off of the same information.
So again, just to be clear, the VRAS system is the state system that we're working on to get everybody on so we can see that statewide view of all the vaccines are going out. It's a scheduling system, it's an inventory tracking system, and that is the one that ultimately everybody's going to be on to be able to deliver these vaccines. And then just kind of follow up again. So the local, because I think, Jose, you asked about, say, first responders being in there, not educators. That would depend on the local health district, right? So the health district then works with those pharmacies, and if the health district is not doing educators yet, then they wouldn't be on the list yet. So it really kind of depends on what each locality is doing.
Paul Hamill also asks, is the governor concerned about the low percentage of folks who have signed up for shots? If so, what are we doing, how are we planning to raise that number?
So Paul Hamill is asking, are we concerned about the number of people who have signed up for vaccines? And what are we doing to increase that? Again, campaigns, for example, the Do Right Now campaign has moved from its message of using the tools to slow the spread to really encouraging people to get vaccinated. Same thing with our own state plan, where we, again, are out there in the media, buying ads to encourage people to get signed up. Obviously, I talk about it here at my press briefings to talk about, encourage people. I just did it, first thing this morning. So we're continuing the communication, communication out there to get people to sign up, and would certainly encourage all the press outlets to do the same, to be able to take the message, get the message out there about vaccinate.ne.gov and ask people to get signed up.
Grant Schulte is asking, in regards to our comorbidities plan, what does the medical community refer to? Is there a task force? Will it be left for individual doctors to decide?
So Grant Schulte is asking, what does healthcare professional mean, and will there be a task force? And again, we're going to let the local health directors work with their medical community to tailor a program that's going to be right for that health district. So they will work with, whether it's individual hospitals or providers, doctors, to be able to make that determination about how they want to manage it within their health district. And we're asking providers to then work with health directors with regard to their patients that they believe are going to be the most at risk, and really prioritize it that way, the people they think are going to be at most risk first.
Julie Anderson says, do you have any idea how many high-risk folks there are and how many are in the 50 to 64 age group, and how long will it take to get through both?
So Julie Anderson is asking, how long will it take to get through the 50 to 64-year-old age group, and how many high-risk people are in that category? I don't have those numbers off the top of my head, and again, a lot of how long it will take to get through it depends on how many people are signing up and how much vaccine we're getting. So I don't have, I can't really tell you how long that will take. I can tell you right now that we're, for example, here in the state, working through phase 1B, so we're still in phase 1B, though we do have some health districts that are, can see them getting through that phase 1B in the next few weeks. So again, it's not going to be the same all across the state. It's going to vary depending on each health district as well.
Our next question is, does the governor have any more information from the feds on the pace or amount of doses in the coming weeks?
Julie Anderson from the Omaha World Herald is asking, do I have any more information about the pace with regard to, from the feds with regard to vaccines? So in a White House briefing yesterday, what the White House said is that if we got, 14.5 million as a nation, 14.5 million this week, that next week it should go up to 15.2 million between Moderna and Pfizer, and that they're going to be delivering 2.8 Johnson & Johnson. But then, as Angie already said, that's a kind of a one-time shipment. We ought not to expect to see in the middle part of March any additional Johnson & Johnson, and then toward the end of the month they will deliver more Johnson & Johnson. And then they expected that by the middle of March we should see the number of vaccines from Moderna and Pfizer go up to 16 to 17 million a week, and that's split about 55% Pfizer, about 45% Moderna. So I hope that kind of answers your question. So they are giving us a little bit of a preview of what they expect to see throughout the rest of the month.
And Julie's last question is there an updated anticipated start date for 50 to 64? How many critical workers are left?
So is there an anticipated start date with regard to getting into phase 2? And again, that's going to be dependent on where you are in the state. So I could see that by the end of the month, there may be some health districts that get into that, phase 2A. But again, a lot is going to depend on how much vaccine we get and how quickly we get through the other groups. And I don't, again, have an answer for you with regard to specifics on, the critical infrastructure group. But that, again, will be dependent on the local health district. And again, what kind of uptake do we get? How many people want to get vaccinated and so forth? So there's a lot of variables here that we just can't predict. All right, great, thanks, Taylor. All right, Andrew, you're the only person in the room today, so you got me the rest of the time. Taylor's probably gonna cut you off at some point. You probably start asking hypothetical questions, and then we'll probably end the whole thing, okay?
When do you think you're gonna have the state, registration, take over all of the registration? Does that include, pharmacies as well?
So the question is, when do we think the state system, the VRAS system, is going to be up and available for our health departments? We're actually working with some health departments right now with regard to rolling that system out. And so I expect that we're going to take the next several weeks to do that. Ultimately, we're going to get everybody on that system. And then with regard to pharmacies, yes, they will be using that system as well. So what we want is everybody who's going to be distributing vaccines to be on that system so that we can do the inventory management, do the scheduling, and really have a statewide picture of where we are with regard to getting those vaccines out.
And on that, will you also give people the choice of when they should be contacted for what vaccine they want?
So the question is, will we give people a choice to be contacted for what vaccine they want? We won't be giving a choice from that standpoint. What we will do, though, is when we reach out to you to give you the opportunity to schedule, we're going to be working to be able to say what clinic is available and what product will be at that clinic.
And there's a hearing later on today in which the public power companies are gonna, I guess, be brought in to explain about these rolling blackouts. What question do you want answered from the public power people in the state?
Yeah, so Andrew's question is around, there's a hearing today sponsored by Senator Bostelman that brings in power officials to talk about the rolling blackouts we experienced a couple of weeks ago during the cold snap. And he's asking, what kind of questions do I want answered? Well, Nebraska is a part of the Southwest Power Pool, and I understand there is going to be an official from the Southwest Power Pool attending the hearing. And what I want to know is, what are they going to do? What's their plan to make sure that this is never going to happen again? I want them to kind of lay out the basis for what they think the causes were, where were the weak points, and what steps are going to take to make sure that Nebraskans can know they're not going to be subject to another rolling blackout. We had businesses, I'm going to use Nucor Steel as an example. They are a heavy power user, and their operations were significantly disrupted by this. This was not something that was just a light touch blackout. When you're putting businesses at risk and jobs at risk, that's not a light touch. So this is, and then of course we had all the people who were in their homes who were concerned about, hey, it's minus 20 degrees outside. Am I going to be able to keep the heat on long enough to, not freeze? So these are very serious issues the Southwest Power Pool has to address and make us aware of what steps they're going to take to be able to address this going forward.
Governor in Texas removed mask mandates, opened up to 100%. I guess, at what point do you start considering doing that?
So with regard to Texas, Texas said he got rid of his mask mandate and opened up 100%. He's actually late to the game compared to where we are here in Nebraska, right? If you look right now, we never had a statewide mask mandate, so we didn't have a statewide mask mandate to get rid of. And our DHMs that have been in place for several weeks now basically have most of our rules and guidance, except for the fact you still have to quarantine, which you still have to do in Texas as well. If you're you have to isolate or quarantine if you're exposed or were close contact. And then if you're going to have larger gatherings, have a plan with your local health director. So frankly, we've been much more open up than Texas. They're kind of behind us with regard to this.
We have a question from Kristen Whitman at KPTM. She says, with New York Governor Andrew Cuomo as the current chair of the National Governors Association, what should happen with him?
What should happen with, okay, so the question was from Kristen Whitman at KPTM, with Governor Cuomo as the head of the National Governors Association, what should happen with him? And I presume you mean with regard to the issues that Governor Cuomo is having within the state of New York, and the reporting of deaths and so forth. If Governor Cuomo resigns, then obviously we'll have to find a new chair for the NGA. But I think that's really, I don't know that anything needs to happen in the short term with regard to Governor Cuomo at this time. Yeah, Andrew.
And maybe this is a question for Angie, but as far as those comorbidities and compiling all those together, are you getting the right information from people who registered from the from the counties and things like that coming in? Or do you need them to re-register with the state?
So the question was, with regard to comorbidities, if you are in that age that is, 64 and younger, if you registered with your county, they often did not collect that information. So you do need to go back to the state's website and re-register if you've got one of those comorbidities as part of it. The other thing you need to do, though, of course, is work with your healthcare provider, whoever your healthcare provider is. Unless, Angie, do you have anything else you want to add to that? Nope, she does not. All right, Andrew, you got any questions? Taylor, you got any other questions sent in? All right. Well, again, folks, thanks very much. Appreciate everybody's hard work in controlling the spread of the virus. We need to continue to stay vigilant about this, continue to use all the tools that we've given you with regard to, keeping that 6-foot distance, washing your hands, wear a mask, stay home when you've got those symptoms. Please sign up at vaccinate.ne.gov. That's a great way to be able to make sure you can get your vaccine as quickly as it becomes available. When it's your turn, we can get you scheduled for that. I want to remind people that Test Nebraska is out there. TestNebraska.com is also a great way to be able to help fight the virus, so please get tested. And we will be back here again on Monday at 10 a.m., and then we'll also be back here next Wednesday as well at 10 a.m. for other additional press briefings. So not on Friday this week, but Monday and Wednesday next week, we will have press briefings, 10 a.m. Central Time in this room. Thank you all very, very much, and we'll see you all next week. Thank you, Francis.